Hey everyone, so we're here with Dr. Variety's new LipoLife provider, and I want to congratulate you and welcome you to our family. This is just the beginning of a lifelong relationship. So we're here also with Doug Zuko. He's a LipoLife provider here in Fast Fit Body Sculpting. And Doug, I just want to ask you, if you had to do it all over again, and you're just starting out, what would you do differently than what would you do differently? What mistakes perhaps you've made that you can point out to a new LipoLife provider?
Well, that's a good question. That's very easy to answer. I just wish I had the confidence then that I have now. After seeing all the results with our clients, it's made me bulletproof because I can sit across the table and I can tell people exactly the results they're going to have and what time frame. And I know that's going to happen. As long as they do what we ask, we're going to have great results. So, here's the thing, and it all comes down to pricing because your price is very, very important. Please, the bit of advice I was given in the beginning that I did not listen to was don't be afraid to ask for the price. You have to command a price because if you don't, if you're too inexpensive, your clients just aren't going to appreciate it. They're absolutely
too inexpensive.
Absolutely. If you're too inexpensive, they're not going to take it serious. They're not going to appreciate the value of what you do, and they may not even be compliant. It's all relative to each and everybody. But here's the thing: what I used to do, I had two different prices, and I would charge $9.95 for the one price, which is my lowest package of 10 sessions, and I would charge. You think what it was? It was I don't remember the price because I never got to that. Basically, I had on two sides of the paper. I had the low price and the high price, and I never once got to the high price. I showed everyone the lowest price, and we closed most of the people on the lowest price. I don't remember one person ever getting to the highest price.
You didn't have the confidence.
Exactly, it was me. It was in my head, right? Absolutely. So here's the way I do it now. Since that time, we've raised our prices 4 different times. We've more than doubled the price on our lowest package. But the funny thing is, I rarely sell a low package. We always sell the biggest package. And the reason for that is most of our clientele that comes through here, they need the bigger package. So why not give them what they need? And I price it accordingly. So let me explain exactly what I do. When a client comes in, no matter who they are, I show them our options. We have A, B, C, and D. And I know you can't see this up close, but let me just elaborate on this. I show them a price of $7,500 retail. When first thing they look at 24 sessions at $7,500. And that has a little bit of shock and awe to it. But it's meant to be. Because they need to know that we're every bit as valuable as the plastic surgeon down the road. And then I show them our price, which is our regular price. And then I'm showing them a special price, this is a today only price. And this isn't a sales deal. I'm just telling you flat out. The price goes from $7,500 to $3,600, our regular price, to $3,100 if you enroll today. And they always ask, oh, really? Is that just for today? And I say, exactly. I say, who do you know that likes to spend money? And the answer is no one, right? No one wants to part with their money. But everybody wants results. So I tell them, this is how I push you off the edge. Because you're standing at the edge of the cliff, you're ready to jump, but you're just afraid. So this $500 is going to get you to jump today. And that's exactly what we do. So the majority of our clients come in and they enroll for the bigger package, which is $3,100. Now, some people don't need that big of a package, and I'm not going to oversell them, but I always start at the top and work from the highest prices down. That way, when they get to the pack that makes them comfortable, it's a relief, and they've actually gone down in price, and we're not trying to upsell them. So actually, you can do a service to your patients and clients by giving them what they need. Don't oversell them. They'll all come back to haunt you, I promise you. But don't be afraid to start at the top and work your way down.
Just role play with me just a moment. Doug, I see the value in the enroll today price. I have to talk to my wife.
Oh, and I appreciate it. And I understand that. You don't want to upset your husband, but listen, he has your best interest at heart. If it makes you more comfortable, please just give him a call right now. I'll step out of the room. Tell him what's going on. Tell him how you can save $500 by acting today. Let's get it done. I'll step out and you make the phone call.
Let me just ask you. I get it. I just don't feel like I don't like being pressured. I feel like that's a pressure deal. Help me out here.
Well, I understand that too, but this isn't pressure. I'm by no means pressured. But what this is a little push off the edge because no one wants to spend money. Everybody wants results. Nobody wants to part with their money. I understand that. But what I'm doing is I'm incentivizing you today. You enroll today. I give you a little nudge, and you're going to save $500. It's as simple as that. Or you can go ask your husband and wait till tomorrow and come back and pay $26.55. It's up to you.
I'll take it.
Here's what, and I just want to, we're talking just to you doctors out there, so I want to be a little candid with you. Because tomorrow, I don't get many patients or clients that walk out the door without enrolling. We're about 85% or higher. But what you'll have those one or two people that are going to test you. And they want to see if you have integrity and they want to just try you. So they're going to leave and they're going to come back in tomorrow and they're going to try to come in for the $21.15 price, $21.55 price, which was our special price, right?
Mm-hmm, mm-hmm.
Okay. I don't want to be a hard guy, but I also, I have integrity. I can't do what I said I wouldn't do.
Right.
So here's the way around this. My regular price was $26.55 for 12 sessions. If you look at this, 16 sessions is $31.55, but I have a special on it enroll today for $26.55. I make it really simple. We both compromise. I said, listen, I can't give you the $21.55, but I will give you the $26.55 like I promised. But here's what I'll do. I'll throw in 4 more sessions. So you're getting the 16 session package for the do it today price. So win-win for everybody. We all win. Everybody's happy.
What if they need the more sessions? If, somebody coming in, they're obese, they need more. They need the 24 sessions.
Well,
how do you handle
the way I have it priced, it's basically 50% off if you go for 24 sessions compared to 12.
Gotcha.
Right? And people may come in skeptical and they may have may want to see it to believe it, whatever. But realistically, you're giving them the incentive to make a big investment. They're going to invest in you, but you're also rewarding them for that investment, and you're going to invest in them. So that's why it's structured that way, and it's all up to the individual what you'd like to do. What you could do is offer a little time frame window. I don't do this anymore. I did offer clients the incentive if they enroll today that I would let them upgrade for $1,000 to a bigger package. I don't do that anymore. It's cut and dried. This is the prices. This is what you take. If you want 12 sessions at the end, we're going to charge you another $21.55. But if you'd like to and you want to make something a little bit in the middle, the best way to do it is give them 2 weeks. Give them 2 weeks to come in here and at least feel better and see a little bit of results. And if that's the deadline that you set, you must set a deadline because if you don't set the deadline, they're going to string you out forever. So you set the deadline in 2 weeks. They have a chance to upgrade for $1,000 to the larger package.
Would you recommend that? Would you recommend just keep it cut and dry?
It's a lot easier to keep it cut and dry. But some of you want to compromise a little bit, and that's the way to do it. But right now, it's a cut and dried process.
So if they come in on the lowest package, you don't let them upgrade. They got to purchase another lower package.
Absolutely. And one way to get around that, if they complain later on, is get some referrals. Say, hey, refer some people, and I'll give you a discount. Simple as that.
Doug, have you ever thought of when you're incorporating the sessions, telling how much each session costs? I mean, a session up here will cost $85, and a session down here will cost $125 in each package.
I don't like to do that. I will if I have to, but I don't like to break it down as far as sessions because we don't sell sessions. We sell packages. And I let everybody know when they come through the door that we have to have results. They're going to pay for their session up front because that's their commitment to me. That's their investment in me. And I have an investment in them. And the investment I have in them is we have a no-lose policy. We cannot fail. Failure is not acceptable. We're going to win no matter what, right? So when people come in, they look at these pricing. They get an advantage. They get a huge discount if they make a bigger investment and go for more sessions. If they choose to do 12 and then 12 again later, they're going to pay almost twice as much for that second 12 sessions. They're going to pay exactly twice as much for those second 12. So they make the investment in me. I make the investment in them. If they really push the issue to break this down, basically our lowest, per price with 12 sessions, basically $150 a session. And if they enroll for the 24 sessions, it goes down to $116. So it's a huge savings. But I will point that out if I have to, but I just don't want to confuse it. It's not necessary. Basically, we just got to get there. We're selling results. It's what I'm selling. When people come in this door, one thing, they don't care about what we do, how we do it. They just want to know what they're going to look like when they leave. And that's the bottom line.
You oftentimes say for 12 sessions, you pay $21.50, and for 24, you pay $31. You're actually saving X amount of money between the two. In other words, if you have 12 sessions, it's going to cost you $4,300 as opposed to $31.50.
Well, one thing I don't do is I don't rattle off these numbers. Okay, we can talk about numbers all we want, but it takes people a little bit of time for that to sink in, right? So all I do is I read off the top package, the retail, our price today, and I explain why we have a price today, and I show them the other options, and I let them think of it. I don't say another word.
Absorb those numbers as opposed to absorbing math.
Exactly. And I keep my mouth shut until they make a decision. And at the time they make a decision, then I may point out to them, how to get additional savings or what my recommendation is to them. But I let them speak first.
So what do you say? Which package do you want? What is your question? What is your question that you wait for?
I don't have a question. I basically explain to them retail price, our price, and our special price.
And then what? Then you just shut up?
Do they ever ask, what results can I expect?
Yes. And that's a really good question, because a lot of people do ask for that. And I explain to them it's not magic. It's science, but it is not magic. And they're not going to walk outside looking like they're 25 and Barbie doll, right? But what they can expect is over 10 sessions, 3 to 9 inches on 3 measurements. And that's what the LipoLite averages are. And I'm very upfront with them. I tell them that we do better than the LipoLite normal averages. So that's a minimal results. And I also am going to start our lowest packages at 12 sessions. Remember I said 10 for 3 to 9 inches? We want to do a little better than that yet. So minimally, we're going to do 12 sessions.
It's brilliant. That's smart. What about this? I love what you're saying. I just want to try it. Give me 3 sessions. If I'm happy with results, then I'm in.
That's a good question. But here's how LipoLite works. Okay, it's going to raise your metabolic rate over time. So basically, what's going to happen? You're going to burn more calories at rest later on than what you do now. So what's going to happen? Your last half of your sessions, your last 6 sessions in a 12-session package, is going to be way more powerful than the first 6. The last 3 is going to be 4 times more powerful than the first 3. So if you walk in here and have 3 sessions, it's very possible you will see, even though you're going to have results, you're going to see no physical results. And at that point, you're going to determine that the device does not work. But you will be wrong.
Doug, something just crossed my mind. You have this laminated sheet here, and it should be, you explained that it should be laminated, by the way. But you have this laminated sheet, and because it's laminated, and you're telling me that this is just my today's only price, but it's clearly this is the permanent price here.
Right. And it's today's price for you. This is your first time through the door. Let's face it, you need help. You've tried other things, they don't work. So you're in need of something different that works. You come in the door, you like this, you're going to do it anyway. So this is my little push, because you don't want to spend the money, nobody does. But we want the results. You're going to do it, I know you're going to do it, so if you do it today. My reward to you is a $500 savings. Let's do it. And this is why it's laminated. Never let anyone walk out the door with your pricing. That's the kiss of death. You want to have problems? Let them take your price sheet home. So you laminate the price sheet, you lay it on the desk, they don't touch it. Very simple.
So Doug, I get about the pricing that you never want anybody to ever take your pricing and take it out the door. But what about, how do you handle the phone calls? When somebody calls in and say, well, what's the price? How do you handle?
Well, that's very simple. But one of the things you need is a very skillful person to answer your phone. And when I say skillful, people take that as someone knowledgeable. And that's actually what you don't want. You don't want to have the person answer the phone giving away your knowledge. Because here's what they need to do. They need to create curiosity. Curiosity is what gets people through your doors. If you give the information out when people call in, there's no need for them to come. They don't see your wall of fame. They don't see you. They don't see your sincerity. They don't see what the results are going to get. All they see is money they're going to spend, and they won't come. If they won't come, they will never be your client or patient. But let me tell you this, if you get someone on that phone that answers the phone is very nice and sincere and tells them that they'd love to help them, but they just don't have the knowledge to help them, that's why we do consultations specifically to your needs. Patients and clients will come through the door. And if you do your job, 90% of those clients will be your customers.
So you want to give them, you want to create an era, you want to just book them in the door without giving it as little information as possible.
When are you free? Monday or Tuesday, morning or afternoon?
Almost as if I'm just an appointment taker, I don't even know pricing. That's why it's better to have a third party person just taking appointments.
Absolutely. Monday or Tuesday, morning or afternoon. That's all I need to know. Works like a charm.
But how does it work?
You know, ma'am, I would love to explain it to you, but if I did, I would mess it up anyway because I really just don't know. So let me be very honest with you. I'm the person that answers the phone, and my job is to be very, very nice and take precise and accurate appointments. So what day are you free? Monday or Tuesday? Morning or afternoon?
Tuesday morning.
10 o'clock.
See you then. You have anything else?
That's it.
That's it. Thank you, my friend. Dr. Grant?
Thank you.
Congratulations.
Thank you very much.